We're back now, 22 News in Focus here, and today we're talking about mental well-being during the coronavirus crisis. Kimberly Lee, Vice President of Resource Development and Branding for the Mental Health Association, is here. COVID-19 has impacted the daily lives of our children. Therapists, psychologists, they'll say that children need that discipline and security of a daily routine. As schools and home routines are disrupted, children may have trouble regulating their emotions, their behaviors. They need play and social interaction, right? And learning loss is natural during the summer, but it may be tough for children to catch up academically without the classroom environment. So my question to you right now first is, how can parents and caregivers discuss COVID-19 with their children in a way that's helpful to reduce their fear?
Sure. Parents and children, we know, and certainly research continues to validate that parents and children have been substantially affected by the COVID pandemic. In fact, more than 1 in 4 parents reported worsening mental health, and 1 in 7 parents reported worsening behavioral health among their children since the pandemic began back in March. Worsening of parental mental health and children's behavioral health were at times intertwined, with nearly 1 in 2 families, according to the Centers for Disease Control, reporting worsening of both. So loss of child care, delays in healthcare visits, and worsening food security were common among families experiencing worse mental and behavioral health. So there's a lot of research out there that certainly does suggest that the pandemic has had an extremely adverse effect on parents as well as their children. But there are things that parents can do, certainly to support their children, trusted adult caregivers to support the children in their lives. And you know, one of the first and probably most important is to remain calm. To remember that children will react to both what you say and how you say it. They will take their cues from you. They will pick up from conversations that you have with them and with others. So always remember that more than likely your children are listening. So to have a filter, be aware when they are around you in terms of how you are discussing COVID and the concerns that you have.
Yeah, their ears are always open, it seems, aren't they? They're always listening. But what about for parents, though? How important is it to listen to your children and let them, express their concerns, and then do you address them after that? Like, how do you handle that?
Sure. It's as a parent of now 2 college-age children. One is a freshman and one is a junior. Growing up, my husband and I would always say to each other how important it was for us to be full-body listening, which meant not having, one ear on the cell phone and one ear to your child, or, not to be tapping away at the computer and making pretend you were listening, but really full-body listening to our children. And so, as a suggestion, to adult caregivers and to parents, to make time to truly listen to your children and to ask them how they're feeling, and then really listen to what and how they respond. It's important to always take time to talk with your children when they're worried. They need to know that they can express their feelings, that it's okay for them to ask questions, and to know that you will always take the time to answer those questions.
And you mentioned, you talked about, I'm sorry, go ahead.
No, but I was just going to say that it's also very important for parents to have a heightened sense of awareness in terms of what their children are seeing and hearing, whether it be on television, online, on the radio, perhaps what they might be reading. Children can often see and hear more than their parents and caregivers realize. So it's important to know what your child has seen or heard about COVID-19 so that you can openly discuss any worries or more importantly, or just as importantly, I should say, any misinformation.
And I was going to say too, because the fact that they're going to be online, probably even more so because many of these children are going to be learning from home. So they're going to be in front of that screen. Just kind of policing and monitoring what they're doing online can probably be pretty difficult. And like we mentioned, most schools are going to be online this fall. That can create stress for both the child, but also for the parent or caregiver, because they need to know how to work those portals as well and
Absolutely.
manage all of those expectations. So what can you do in those situations when it is high stress? How can we de-escalate the situation?
So, it gets back to being really tuned in and aware of how your children might be acting. Are they potentially overreacting? Are they having difficulty sleeping? Has there been interruption in their eating? How are they behaving? Are they short and tend to be more angry and intense, where once they were, fairly happy-go-lucky, if you will, but now they just seem to be much more stressed. So it's just being very aware of how they're behaving, how they're reacting. Those are some of the best cues and signals that parents can take in terms of how it is that their children might be feeling emotionally.
We're going to learn about resources to help with mental wellness. You're watching 22 News in Focus.